Welcome to Learning Unit number 9. In this learning unit, we're going to be focusing on palliative care, and most specifically, the content will be on medical aid in dying. While we're also going to be, as we talk about medical aid in dying, we're also going to look a little bit more deeply into the death with dignity laws that surround medical aid in dying. So the first thing to be aware of that I want to make sure is utterly clear is that in Pennsylvania, medical aid in dying, which I will define and we'll talk about, is not legal. It is not legal in New York State or Ohio, where many of you reside. New York State does have some pending litigation and legislation regarding medical aid in dying. But we're learning about this because 9 states and the District of Columbia now do have death with dignity laws that allow for medical aid in dying. So we're going to identify the specific criteria that a person needs to meet if they want to use medical aid in dying. The impact of this as it correlates to healthcare providers, terminally ill patients, as well as the families, and what potential ethical issues could arise. And we're also going to have a chance to do a mindful body scan. And that allows us to bring awareness to our body, which helps ground our attention in the present moment. So first, you're reading chapter 6 in your text, which is entitled Inhabiting Your Body. And of course, we're continuing on with learning about mindfulness. So that's our first instruction for the week. And you're going to be able to complete a body scan. So let me just show you. There's a 3-minute body scan, just so that you can at least experience this. So you can choose to do the 3-minute body scan, or you can do a 30-minute body scan. You can do both. But I want to make sure that those with limited time do at least have that experience. This is by Jon Kabat-Zinn, who is renowned as far as his work in mindfulness and mindfulness-based stress reduction. Having a hard time talking today. So MBSR was originated by Jon Kabat-Zinn. So the next article, which is a relatively brief article, really gives us the why are we looking at palliative care and medical aid in dying? Why? Especially if we reside in a state where medical aid in dying is not legal. But this will give us, death literacy, according to the authors, and I would agree, among healthcare professionals is dismal. We need more education. Compassion and Choice is a fantastic website, and this is the link to information specifically on medical aid in dying. There is a video embedded within this web page that is optional. You can watch that. I think it's helpful, but with any time constraints, you may just, or if you learn better by reading information, you may want to just review the written information on this web page. Then there is one, instead of a video this week, there is a fantastic podcast. And it truly is. This is a physician that practices and lives in Canada. So their laws, of course, are different. And you got to keep that in mind because their medical aid in dying, which is legal in all of their provinces of Canada, is different than the states that we have here in the U.S. that have medical aid in dying. So the author or the interviewers are physicians who practice in the US. So you do get that clarification of what is legal and how it's practiced in Canada versus what is legal and practiced in the US in regards to medical assistance in dying. It's an excellent podcast, so you're going to listen to that. And you do have to sign up once to get this, to be able to see this. There's no payment due. You can see it immediately upon registering. So click on this link, and right beneath, before you can start, it will ask for some basic information. Again, I would say of all the information, this is key content. And then there's a Death with Dignity site that actually lists what states have death with dignity statutes or laws, or what states have pending legislation. And I want to come back to this in a minute. And here's another Death with Dignity frequently asked questions. Again, all of this information is coming together to help you best understand what states have death with dignity statutes, what states, what does that mean, what needs to be followed, etc. So again, this frequently asked questions is information only for states that have these statutes, that have these laws. And specifically, they took 3 of the states that do, the state of Oregon, Washington, and Vermont, and they compiled information that a lot of people ask about death with dignity and medical aid in dying. So remember, the death with dignity laws allow for medical aid in dying. So that's how the two terms kind of go together. And perhaps I've blended them a bit too much. So death with dignity laws or statutes are state specific. And each state makes up their mind whether or not to have death with dignity laws. And death with dignity laws allow for medical aid in dying, which you're learning all about by going through this material. And the quiz is going to be on the information that you read and review as you listen to the podcast and as you read the information on the web pages. And finally is the discussion board. And as was requested, and we did last week, we're trying to extend just another day before you have to post your discussion board. That was based on some feedback. I wish I could give you longer, but this will be due Friday night. And our discussion board just starts with a synopsis of what states, and 9 states and the District of Columbia do have these death with dignity laws. So 9 states now allow for medical aid in dying. And that's where a patient is given a legal prescription for life-ending medications. In the U.S., no states allow for physicians to administer these medications. The patient has to be able to take them themselves. And so in Canada, you're going to listen to the podcast and hear how it's different. So after reviewing your materials, please answer these questions. And by Sunday, reply to at least one of your peers. You may want to look back at the ethical principles from week 7. So do you believe it's medical aid in dying is ethical? Yes or no? Why and why not? For your responses. And remember, when we're reading a peer's response, an ethical question, we have to be very cognizant that in ethics there is no per se right or wrong. People have reasons, rationale of why they think something is ethical or is not. I do want you to reply, though, answer this question using one or two of the ethical principles. But we will be very respectful on whether one agrees or disagrees. And do you feel that it should be legalized in the state that you reside? Again, why or why not? And then, what surprised you most when you were learning about medical aid in dying or learning more about medical aid in dying? What most surprised you, or what specific, process that the patient goes through in states with medical aid in dying legalized? What most surprised you? Share with us on that. So going back to seeing what states have death with dignity laws, this is very current. So what I want you to look at are states that are considering. There is legislation up on states regarding death with dignity this year, this congressional session. So you're going to see New York, Connecticut. I'm not sure where everybody is from, but you can see the states that have some legislation pending. And of course, that would come to a vote. But these states are considering having death with dignity laws, which would allow for medical aid in dying. Which states already have this death with dignity statute? And again, 9 states in the District of Columbia. And which states do not have any active legislation? So you can see Ohio and Pennsylvania. Where's Pennsylvania? There we are. Do not have any legislation pending. There is no discussion currently in these 2 states for death with dignity laws. And then Montana, you can read about why their legislation, they do have a death with dignity law. It's under threat, so it might be interesting to look at that. And then there are certain amendments pending. One of these states has an amendment pending that nurse practitioners can write scripts for medications that will be end of life medications for their patients to take in their state. So that was one of the amendments. But it looks like there's issues in Montana that they're not going to perhaps continue on. So this is a really just quick eyeballing of the states that have it, the states that are pending bills, states that it's been enacted. So I want you to take a peek at that, and we're done for the week. So I have looked through. I know we've talked a bit before. I've looked through your feedback. I thank you for your midterm feedback, and I'm doing my best to, wherever possible, make some changes for you. So thanks and have a great week.